Now, approval by the National Council of Provinces of the controversial National Health Insurance Bill continues to draw fire, with a growing number of organizations saying they will petition President Cyril Ramaphosa to send the legislation back to Parliament. The National Health Insurance Bill was passed in the National Council of Provinces this week on the back of support from 8 provinces. The controversial legislation will land in the tray of President Ramaphosa, who must now decide what to do next. Joining me is Dr. Angelique Coetzee from the South African Medical Association. It's a pleasure to speak to you once again. Good morning. Welcome to the show.
Good morning, and a good morning to all your viewers out there.
All right. So, Dr. Angelique, I think personally, I've seen this past week has been a busy one locally on the news front. It's been extremely busy. But one of the dominant discussions, or something I think a lot of people have been paying attention to, and if they haven't been paying attention to, I think they need to pay attention to, was this particular bill that has finally been passed. Of course, earlier on, we did see it be passed in the National Assembly, and then the National Council of Provinces approved of it this week. And the next step then would be for the president to sign it into law. Tell us what we need to know about this particular bill and what effect this could have on public healthcare and for the general public.
Yeah, I wish we all knew what was going to happen going forward. As it is currently, the bill was open for discussion. It started in 2019. We had submissions to Parliament. There was public submissions as well. Roadshows has been happened. Even National Department of Health also made some changes or suggested some changes, and actually nothing changed. The bill that was on the table in 2019 is the bill that's been accepted without any, as far as we can determine, without any changes. So that is an area of concern. Secondly, the bill is an insurance or the money. It talks about the money, and then that money would need to address certain health inequalities that's out there. The problem is no one knows what the health or the diseases it's going to tackle. The popular thing from from government is that the bill will restore inequality. The bill is going magically to fix the public sector, and it's going to, for those 18% of people who belongs to a medical scheme that has been accused of privilege, their money will then go into the pool so that there is better care for everyone around the clock. So why? We do not have a problem with universal health coverage, where everyone's got access, not only access, but access to good clinical services. You should not discriminate against people who's got money and who doesn't have money. That's a given. We don't have a problem with that. However, we've got a problem with the way that this is going to be implemented. As I've said, we actually don't know what's going to happen. To say that 9 million people belonging to a medical scheme are privileged and they are responsible for 51% of the healthcare costs is disingenuous. So I, as a member of a medical scheme, I choose to belong to a medical scheme because I've got a job. If National Department of Health and government actually made sure that there are enough job creation out there for entrepreneurs to come into the market, we would have seen a greater population belonging to medical schemes. So people can't belong to a medical scheme if they don't have a job or work. So they then rely on the private or public sector. I also choose to buy a medical scheme or to belong to a medical scheme instead of buying a car, using my premise for that. So then to say I'm privileged, it doesn't do me well. I'm sorry, that is not a good argument to use. So if you come back and look at the public sector, the wise thing would be to increase the service delivery in the public sector. It would be much more convenient to everyone and in anyone's, in all the patient's favor, if we can have a public-private partnership in the various communities with the local clinics and try to better the standards and give good quality healthcare services to people belonging to the public sector. If you then look as well, all the powers that the minister will have, that is really some red lights. We know the current inefficiencies, we know the corruption, we know the cadre deployment, we know that money is not accountable for, we know as well that people are not accountable for all their actions that's leading us down this rabbit hole. So for the public there that think that if you then combine public sector and private sector, then all of a sudden the public sector is going to be rescued. I've got a surprise for you. You cannot rescue the public sector in its current form. You have to make hard changes in the public sector and keep your private sector where it is and try to bring the standard of healthcare up to the private sector. Do not take the private sector and also drag it down to a lower level that we are going to have and the public sector as what we currently have. I hope this makes sense.
Yes, absolutely. And thank you so much for contextualizing that. I think it's important to understand the context of the matters that we're discussing. Now, the NHI, I think ANC members of parliament this week have described it as an unstoppable train. They say it's going to go ahead, regardless of whatever the opposition says. But businesses, medical professionals, they are gearing up for a fight. And I think Health Minister Joe Pashla said earlier this week as well that there was popular public support for this bill, which is why they're going to go ahead with it. Would you say medical professionals have been given a fair hearing in this?
Well, it depends on how you look at it. So for government will tell you we had ample time to submit our submissions and our concerns from the whole of the medical fraternity, which we did. And we showed them where the problems are lying. But none of that, it is a tick box. For us, it was a tick box exercise, because if you look at all the submissions that was done, none of that. I would like government to show me from the 2019 bill what comments has actually been taken into account and been put into the draft bill. As far as we can see, nothing, none of anyone's concerns. So to say there was a lot of public support, does that mean COSATU? Does it mean the trade unions? Or is it, what did the average public persons out there said? Are there stats? Can you show us the stats, Minister? So we would like to see that on paper, where this overwhelming support is coming from. But just to say to us, yes, there was a lot of support for this. There's also a lot of not support for the NHI. And again, we not dispute a universal health coverage. It's not about that. It's about the money that's going to be used for something we don't know. And also, for me at this stage, looking at the private sector, at medical schemes, I've got the feeling that within the next 3 to 4 years, at the current rate, our economy is going down and slowing down, that medical schemes will in any case price themselves out of the market. So we are going to sit with more people making use of the public sector, less people being able, because of job losses, to contribute to this NHI insurance bill, so that this equity dream can then be fulfilled. So it's not, I don't think it's ever going to happen, not in the current situation.
Now, we do know the state of public health care in South Africa. I don't think it's a mystery to anyone. You just have to go to the nearest public hospital and you will see the state of South African healthcare at the moment. And I think a lot of the concern that healthcare professionals have raised about this bill is that it actually, instead of strengthening the public healthcare system, it's actually going to put the private healthcare system at risk, which we know is actually on a world-class level. So I want you to think about this question, Dr. Coetzee, just quickly while we take a break, and when we come back, I just want you to think about this question. Is the NHI going to be the straw that breaks the camel's back when it comes to public health care?
This is Salam Media.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bayt Lodge, your true home away from home. Al Bayt is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities. Conveniently situated close to Port Elizabeth Airport, the beach, and other amenities, your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bayt has to offer. For reservations, call 041 583 6415 or visit www.albaytlodge.co.za.
There's no smell that takes me back to the comfort of my childhood than the smell of black seed oil being applied by my nanny. Now I'm using Tib black seed in my own home to soothe sniffles and coughs, to help with digestion and immunity, and of course, as part of my beauty routine. After all these years, I've come to appreciate the wisdom in finding comfort and shifa in trusted treatments like Tib black seed. You can find Tib black seed at all leading pharmacies or find out more at blackseed.co.za.
Sponsor an orphan, and you'll help support a vulnerable child to have the education they've always dreamed of, so they can build a brighter future. You'll be feeding a hungry stomach and a hungry mind with knowledge that will last them a lifetime. That's the power of an education. Sponsor an orphan now with Islamic Relief.
Ah, the kitchen, the heart of the home, where memories are made and celebrated. Our go-to place for those freshly stacked pancakes early in the morning or for that late-night snack munchies. We are in there together, cooking, eating, and celebrating life together. Let's keep the kitchen a place that is shared by everyone, where we build stronger bonds and grow together. Sunfoil, Now We Cooking. Visit nowwecooking.co.za for recipes that everyone can help make.
Conveniently located along the banks of the Crocodile River bordering the Kruger National Park, as a guest at Buckler's Africa Lodge, one can enjoy an amazing sunrise or sunset on our spacious deck area while you catch a glimpse of some wildlife sightings along the Crocodile River. The sounds of the African savannah will greet you whilst you enjoy your morning coffee. Buckler's Africa Lodge by Tingana Collection. Buckler's Africa Lodge is ideally situated only 6 kilometers from the Crocodile Bridge Gate in the Kruger National Park. Catering for all travelers with variety, we have 4 types of the finest rooms: superior rooms, deluxe suites, and 2-bedroomed family units. Each room is equipped with the finest amenities to make your stay unforgettable. Guests can choose between the self-catering option or book their accommodation with breakfast and dinner included. Buckler's Africa Lodge is your ideal location for the ultimate Kruger getaway experience. We specialize in exhilarating and educational game drives in Kruger, tailor-made to suit your family. Inquire about our various accommodation offerings and other activities. Visit www.tingana.co.za for more information. Buckler's Africa Lodge by Tingana Collection. Experience the pulse of Africa with us.
Rejuvenating media day by day. This is Salam Media.
25 minutes past 8 a.m. Central African Time. Welcome back. You are tuned into Salam Media. My name is Zai Jadwat, standing in for Inayat Wadi. And with me is Dr. Angelique Coetzee from the South African Medical Association. And if you're just joining us, we were actually, before the ad break, speaking about the National Health Insurance Bill. And Dr. Coetzee outlined a number of concerns around this bill, which is just one step away from becoming law. Dr. Coetzee, just before we broke for the ads, I asked you, was this going to be the straw that broke the camel's back when it comes to public health care?
Yes, unfortunately, in its current form, if the president write this into an act, it's definitely going to be the last straw, not only of public sector healthcare, but of healthcare in South Africa as we know it. How much they would like to sugarcoat it. That as well as the newly changed ethical rules of the HPCSA, allowing commercialization of healthcare practitioners registered with the HPCSA. That is also going to have a huge effect on the delivering of healthcare going forward. And if there's no common sense going forward, and the president just blindly go, and as I've said, write this into an act, we are going to see doctors leaving the country, but not so much leaving the country as well, but doctors that are at the age of nearly retiring but still carrying on with private sector services to their patients, they will just retire because they are at an age where they can retire. And we know that the majority of doctors in the private sector are above the age of 50. There's not a lot of young doctors coming in to the private sector for various reasons. So we are going to, the intended intention of the bill or the act, the proposed act would then be to give healthcare services. Unfortunately, you're going not to get that through medical practitioners. We are going to move into a new domain where your pharmacist is going to give you medical care, nurses are going to give you medical care. You will have the odd medical private doctor in some of the, especially in the rural areas. You will still have a few in the urban areas. But in 10, 15 years from now on, I'm not sure where you will go, what is going to happen to primary healthcare. Remember, the whole thing about the bill is also to improve primary healthcare. So to have universal health care, it's based on primary healthcare, as it is currently as well. I'm not aware of private sector doctor groups really involved in planning going forward with National Department of Health on how we can do this public-private entrepreneurship going forward to make everything for the best of the patients out there. That nothing of that is happening. All that we're hearing is the insurance bill is going to happen, money will be made available because we're going to throw the private sector money into the public sector. Again, only 9 million people are privileged, and those privileged, it can't be for the rest of the country that's not privileged. So how on earth you're going to get 9 million people's contributions, put it in a pool? And we are not 60 million people in our country. The latest stats also, although the stats also is not very, you can't really trust the amount of people who's currently in the country. So for me, we're nearly 90 million people in our country, because you look at all the illegal immigrants, you look at immigrants, you look at everyone coming into our country. Remember, they will also have access to the insurance bill or to healthcare, especially if the children is under the age of 5. We cannot stop them. So how on earth 9 million people are responsible for the demise of the public sector? I'm not so sure how you can sugarcoat that. I'm not sure.
No, I think if we actually look at it, healthcare is a very unequal playing field, like many sectors in South Africa. And that is a reality, and we understand that. And I'm sure you do as well. When you look at it, there's like 3/4 of the South African population relying on public healthcare, and that is not of the best standards. But we do know that the NHI in its current form is not the best solution to any of the problems that we have in healthcare at the moment. So as SAMA, are you aware of any alternatives, any other model that might actually work in a way that the NHI might not?
So from not, I can't speak on behalf of the SAMA board or SAMA on other models, but what I do know and what I'm aware of is that the model that should actually work is where you have the public sector or the local public clinics working with the local general practitioners or other allied healthcare people that's in the private sector to form a partnership where the patients are allowed to come into your surgery, and you can at least send them for x-rays, you can at least have some blood tests done, working together. That is a model that needed already to be looked at. So for what we are hearing is, don't worry, you will be allocated between 3,000 and 5,000 people to your surgery, and you're going to have lots of money, which is not true. You know, money is not the driving factor. Yes, we do need money. I mean, I cannot go to Pick n Pay and say, I'm giving a free service, please give me a free bread. But it's not so much for doctors, especially in the private sector, about the money. It's about giving care, and about being able to help your patient, because it becomes very disheartening if you sit with a patient in front of you, you've got no money, you know what needs to happen. If you send them to the public sector, they get scolded because they went to the private doctor, and if you can afford a private doctor, why do you come to the public sector? That mistrust between the public sector and the private sector should stop. And if you can get that right, and we can start working on a model, do we then really need NHI? Because as it currently is, everyone's got access to healthcare. Everyone. But that's it. I'm always saying access means I can walk into the clinic. I've got access to healthcare. But it's not telling me that I've got access to quality, appropriate healthcare for the condition that I'm suffering or my loved ones are suffering from. We need to sort that out. So no amount of money that you throw into this rabbit hole is going to make a difference if we do not address the primary problems that is experiencing in the public sector. And please don't think that the private sector are that good. The private sector is only that good because we've got such a low bar when it comes to the public sector. So both sectors, we need to up our game. We need to look more holistically at the patient. We need to get outcomes-based indicators, make sure that you treat the patient, to the best of your ability, and that we stop being a curative medical fraternity. The people out there need to also understand we need to go back to preventative medicine, because if we can bring preventative medicine and primary healthcare in, a lot of the tertiary costs will come down. And again, job creation, it's so important, because if there's jobs, people can actually afford healthcare. If there's no jobs, you cannot afford healthcare, and more people will depend on the public sector. And there are pockets of excellence in the public sector. So it's not all public sector hospitals and managers that are corrupt and not being able to run their clinics or the hospitals properly. There are good ones out there. But again, we need to learn and we need to work together. We cannot work in silos.
Dr. Coetzee, just as briefly as possible, if you had a message that you could get across to the president before he put ink to paper on this bill, what would that be?
Don't sign it. Let's go back to the drawing board. Involve your medical practitioners, all the doctor groupings, involve us. Let us sit around the table, even if it takes us 2 months or 3 months. Let's sit around the table. Let's sort this mess, because this is as you have said, would that be the last straw? Yes, it will be the last straw. And once if you have written that into all the court cases that's going to come up, everything, you are only going to irritate people, not thinking this is a good bill. And again, for those people out there that think it's going to save you, you're all of a sudden going to get better healthcare in the public sector. It's not going to happen.
All right. I think that's all we've got for this morning. Thank you so much for your time.
Thank you. Thank you so much.
That was Dr. Angelique Coetzee from the South African Medical Association speaking to us about the state of healthcare in general, but particularly the NHI Bill, which is now going to be sitting on the president's desk and waiting for him to sign it into law. Lots of concerns around that. Let's take a break. When we get back, we'll continue with the show. Please stay tuned.